So this was also a multi-institution study, and the premise is that patients with recurrent localized head and neck squamous cell carcinoma also need improvement in their outcome. If you look historically at the outcome for these patients, it is not very good. These patients typically undergo either surgical resection, sort of a surgical salvage, followed usually by radiation therapy, depending on the risk features they have. And so when we designed this trial, we wanted to improve on the historic data as well, and looking at the progression-free survival for these patients. And so historically, these patients are stratified or classified into different categories depending on the timing of the relapse after the initial radiation therapy, depending on whether they had salvage surgery or not, and depending on whether they have a permanent feeding tube or a permanent tracheostomy. And so based on these criteria, we selected patients with what we call RPA 1 and 2. Typically the 1-year progression-free survival for these patients hovers around 40%. And so what the trial attempted to do is to see whether the addition of Nivolumab, which is a PD-1 inhibitor, to the reirradiation with IMRT to these patients could actually improve on the progression-free survival. And so the trial accrued 52 patients, and the data is presented at ASCO this year. The data is encouraging since the 1-year progression-free survival is close to 55% for this group of patients. We are still looking at biomarker analysis to see what would be a predictor of improved outcome for the patients. We looked at CD8 positive peripheral cells, circulating peripheral cells and peripheral T cells, and there seems to be a trend favoring survival for patients with an increase of the proportions of these cells by flow cytometry at a few weeks after the initiation of treatment. And we're going to look more at other biomarkers in the blood and the tissue. And so this is in summary the results of this data, and we look forward to also changing the paradigm for patients with recurrent localized head and neck cancer who also need improvement in treatment modalities.